Autism. Navigating communication barriers and social challenges. Effective communication. Facilitating success through acceptance and respect. Effective communication with autistic individuals is a collaborative process that relies on caregivers' strategies and understanding. By respecting and accommodating autism's unique communication styles and challenges, caregivers play a crucial role in facilitating successful communication. Strategies used to facilitate successful communication include active listening. Demonstrate active listening by maintaining eye contact, nodding, and providing verbal cues, such as I see or I understand, to help autistic individuals feel heard and acknowledged. Being mindful of sensory sensitivities. Sensory sensitivities can impact communication. Be aware of potential triggers and create an environment that minimizes sensory distractions or discomfort. Empathy and non-judgment. Approach communication with compassion and understanding. Avoid making assumptions or judgments about the autistic individual's communication abilities. Establishing predictable routines. Consistent routines and schedules can provide a sense of predictability, reducing anxiety and improving communication. Flexibility with communication styles. Flexibility in communication styles is essential when interacting with autistic individuals. Being open to adapting your communication style based on their preferences and needs, whether they prefer written communication or benefit from visual cues, respects their individuality and enhances communication effectiveness. Modeling social skills. Through your behavior, demonstrate appropriate social interactions and communication skills to serve as a positive example for the autistic individual. Patience and extra processing time. Allow extra time for the autistic individual to process information and respond. Avoid rushing or interrupting them during communication. Positive reinforcement. Reinforce communication efforts to encourage continued communication, even if the autistic individual's response is partial or nonverbal. Respecting personal space and boundaries. Some autistic individuals may have personal space preferences and may not be comfortable with physical touch. Always ask for permission before initiating physical contact. Seeking feedback. Encourage open communication and feedback from autistic individuals and their support network to help you better understand their communication needs. Using augmentative and alternative communication, AAC. For those with limited verbal communication, consider using AAC tools like communication boards, picture exchange systems, or speech-generating devices to enhance communication. Using clear and concrete language. Keep your language simple, direct, and concrete. Avoid using metaphors, idioms, or ambiguous language that may be confusing for autistic individuals. Using social stories and social scripts. Social stories and scripts can help autistic individuals understand social situations and appropriate responses. These can be useful for navigating new or challenging social interactions. Using visual supports. Visual aids, such as pictures, symbols, or written schedules, can enhance understanding and help autistic individuals follow conversations and routines. Effective communication with autistic individuals is a collaborative two-way process. Caregivers can create a more supportive and inclusive communication environment by employing specific strategies and remaining responsive to their needs. This can foster meaningful connections and enhanced understanding, benefiting autistic individuals and those communicating with them. Social communication. Embracing and valuing differences. Social communication frequently poses a fundamental challenge for autistic individuals, and improving social skills enhances their quality of life and relationships. To facilitate meaningful interactions and better navigate social situations, Targeted interventions and strategies are developed and implemented to support and refine these skills. Targeted interventions, strategies, and support may include family involvement. Family members and caregivers play a vital role in supporting social skills development. By reinforcing learned skills at home and in educational settings and providing ongoing encouragement and understanding, they contribute significantly to the progress of individuals on the autism spectrum. Functional behavioral analysis, FBA. For individuals with challenging behaviors related to social difficulties, an FBA can help identify triggers and develop behavior support plans to address these challenges effectively. Occupational and speech therapy. Occupational and speech therapists can work with autistic individuals on specific social communication goals, such as improving eye contact, understanding sarcasm, or interpreting facial expressions. Peer-mediated interventions. Peer-mediated interventions influence the social skills development toolkit. By training peers and classmates to support and include autistic individuals in social activities, these interventions foster a sense of belonging and understanding, leading to improved social skills and relationships. Peer strategies include encouraging social interaction, offering assistance, and becoming more understanding and patient with autistic peers. Social group interventions. Participating in structured social groups can offer a safe and supportive environment for autistic individuals to practice their social skills with peers who may share similar challenges. These groups provide opportunities for socialization, role-playing, and feedback from facilitators. Social integration in school settings. Schools can provide social support through structured activities, peer inclusion programs, and by promoting social interaction in inclusive classroom settings. Social skills playdates and social gatherings. Organizing structured and facilitated playdates or social gatherings allows autistic individuals to practice social skills in a controlled and supportive setting. Social skills training. Structured social skills training programs teach autistic individuals specific social behaviors and rules. These programs use evidence-based techniques, role-playing, and modeling to teach skills such as initiating conversations, maintaining eye contact, turn-taking in conversations, and recognizing nonverbal cues. Social support groups and clubs. Joining clubs or groups based on shared interests can offer social opportunities and build friendships with others with similar hobbies or passions. Social stories and scripts. Social stories and scripts help autistic individuals understand and respond appropriately to various social situations. These personalized narratives outline specific social scenarios and guide the individual on how to act, what to say, and how to interpret others' actions. Video modeling. Video modeling involves watching videos of social interactions or situations and imitating appropriate behaviors. This visual approach can be practical for autistic individuals, who often learn better through visual cues. Social skills development and support should be individualized, focusing on each person's strengths and challenges. The ultimate goal is to help autistic individuals gain confidence, build positive relationships, and navigate social situations more effectively, contributing to their overall well-being and social inclusion. Relationship building. Adapting to unique communication and social needs. Developing and fostering meaningful relationships with autistics is a crucial task that requires your understanding, patience, and a willingness to adapt to the individual's unique communication and social needs. Your caregiver, educator, or interested individual role is pivotal in this process. Strategies to help build meaningful connections include active listening. Practice active listening, a powerful tool that can make a significant difference in the life of an autistic individual. Give the person your full attention, nod, and use verbal cues to show that you are engaged in the conversation. This simple act can empower them and make them feel heard and understood. Being non-judgmental. Avoid making assumptions or judgments about an autistic individual's behaviors or communication challenges. Focus on acceptance and understanding. Being a reliable friend. Demonstrate reliability and consistency in your interactions. Building trust is essential in any meaningful relationship. Celebrating individual achievements. Acknowledge and celebrate accomplishments and strengths. Positive reinforcement can build self-esteem and motivate further engagement. Continuing personal education. Learn about autism and its characteristics to better understand the individual's perspective and communication style to help you approach interactions with empathy and sensitivity. Encouraging self-advocacy. Support the autistic individual in expressing their needs and preferences. Encourage self-advocacy and empower them to communicate their desires. Finding common interests. Identify shared interests and activities that can serve as a basis for meaningful interactions and shared experiences. Offering social support. Support autistic individuals during challenging social situations, offering guidance and encouragement when needed. Patience. Allow the autistic individual extra time to process information and respond. Avoid interrupting or rushing them during conversations. Practicing flexibility. Be open to adapting your communication and interaction style based on their needs and preferences. Practicing social inclusion. Include the autistic person in social activities and events, consider their comfort level and preferences, and be patient and supportive during group interactions. Respecting communication preferences. Respect and adapt to their preferred modes of communication. Some autistic individuals may prefer written communication or specific forms of AAC, augmentative and alternative communication. Respecting individual differences. Each autistic person is unique. Respect their boundaries, sensory sensitivities, and communication preferences. Seeking feedback and open communication. Regularly seek feedback from the autistic individual and their support network to better understand their needs. Communicate openly about how to improve the relationship. Using clear and direct language. Keep your language simple, concrete, and direct. Avoid using abstract language, metaphors, or sarcasm, as these may be challenging for autistic individuals to understand. Using visual supports. Visual aids, such as pictures, symbols, or schedules, can enhance communication and understanding, especially for individuals with difficulties in verbal communication. Building a meaningful relationship with autistic individuals requires patience, empathy, and the willingness to accommodate individual differences. Demonstrating understanding and acceptance can create a supportive and positive environment that fosters a deeper connection and mutual respect.